rain, which is good because there was no rain for many weeks. Yeah. So my mom will be in a second. She's coming back from the bathroom.
Okay.
But please tell me, would you prefer her sitting or lying in bed?
I think sitting.
Sitting. Okay, so we organized here. So she's on her way.
Hello.
Hi, how are you?
Okay. All right, so I will put it.
So yeah, just get comfortable.
I will catch back.
Okay. All right. So do we have a spoon? We've been practicing a bit every day. And yes, and I don't know what else do we need. If we need anything else.
Oh, yeah, so much more, I guess. But so what's anything changed yet?
I feel, I don't know how to say in English, takie mrowienie during these exercises.
My mom said that it was a kind of a, I don't know, tingling or in her hand. Left hand, when I did the tapping part. And I also noticed that the left hand, when I did the movement like side to side, there were days when the hand was softer. I mean, not so stiff and not so resistant to the movement. So that's what we noticed.
Yeah, it's a small difference, but a very significant change. Right, that the fact that something is changing in the way she's sensing the hand and something responding to it. But this is probably one of the most difficult for me to work with Zoom.
Yes, I can imagine then Kim, because
I do suffer an enormous amount of anxiety thinking, well, how can I help and how can we make this work? But I think we just got to give it a bit of a go and not have too high expectations and see where we
do
go.
what we can.
Yeah, that's more experimental rather than, because I really have not done this before on Zoom with someone with a stroke, you know.
Yes, I know, because and I am not a Feldenkrais practitioner, so I don't have the sensitivity to details. So definitely I can work as I can, and that's all.
Yeah. So can we zoom out a little bit so I can see the shoulder and arm?
Okay.
I thought tonight we might do a little bit of work on the shoulder too.
Is it better that way?
Can I get a closer look at the hand? And
okay. Maybe a little bit higher.
so no voluntary movement of turning the hand? Nothing new?
No. Is it okay now or a little bit?
That's better. Yeah.
All right. So I will sit maybe here.
So let's perhaps begin with a little softening of the hand. And you can do this hands-on, Agnieszka.
All right.
You can,
And so with towels underneath?
yeah, support the wrist.
Okay. I take the towels.
I can't imagine what it would be like for you to have this. Okay.
What about the right hand? The towel as well, or?
No.
So only left.
if you
Okay.
could cup the fingers of her left hand with yours and begin to, Agnieszka, with your hand. So you cup the fingers, imagine your fingers following her fingers. So you need to turn your right hand around a little bit to go underneath the hand and support it as if from that direction.
Yes, so, but the fingers are like that. So shall I open them a little bit?
No, just put your hand underneath the fist as if you're going to mirror the shape there.
All right.
And then begin to take the hand or the fingers in the direction they're already going. So you're going to squeeze a little bit and pull them under as she's trying to make more of a fist.
All right.
And see if you can get some release doing that. Just start squeezing, pushing in that direction. So you're learning to sense which direction the hand wants to go.
Right.
So it's doing something. It's doing something in a pattern. It's doing like the little fingers flexing in a particular pattern. The second finger, they're all flexing. Yeah. So you use your hand to copy what her hand is already doing. So more or less exaggerating. That's it. And then releasing it. And then begin to, at the same time, tune into her breathing.
Mm-hmm. What do you mean by that?
Or sensing her breath. You can, like I can see her sternum moving. Breathing in now, breathing out. Breathing in now, breathing out. So taking her further in the direction on her breath in, and then releasing on the breath out. So she learns to let go on the breath out. How can you make it mirror her action as best as possible? And then the tips of your fingers can begin to pull the skin downwards as though the fingers are going to begin to straighten. And you push them up and in, and then just do that a few minutes, see if that softens the hand at all. Is by applying the idea of a little bit of pronation, like we did last week or the week before. The hand turning inward a little bit. And how easily is it to bring the fingers out?
Out, I mean, in the opposite direction they're going.
Open the hand. Or is it really rigid? How hard is it?
It's not very rigid, but
you do a bit of that every day, just opening the hand?
Yeah.
Good. Can your index finger go sort of underneath? Yeah. And then pull down. Right. Just till you can feel some softening happening.
A little bit, not much.
As you take the hand in the direction it's already going, take it a bit further so that the elbow begins to flex and the hand begins to move towards the mouth. And then bring it back down again. That's it. So you turn it inward a little bit. So it's a rotational element. You feel where it's already going. You try and follow. That's good. What it's already doing. That's it. Okay, good. Now let that rest for a minute. Now, how do you pronounce your name again? What was the shortened version? Iga?
Iga, yes.
Iga? Iga? Let's now just do a little bit of work with the left shoulder. Just on your own, Iga, bring your left shoulder forward and then let it go back again.
Lewe, trochę do przodu, lewe ramię.
Okay, leave that, leave that.
Like that.
Now the right shoulder.
Prawe.
Come back to the beginning. Feel how your pelvis is sitting on the seat.
Poczuj też, jak twoja miednica
Pay
siedzi.
attention to the pelvis. Bring the right shoulder forward.
Prawe ramię do przodu i patrz, co się dzieje z
That's
miednicą.
it. And back again. And how we do the movement, I want you to connect with your breath. So next time you move the shoulder forward, breathe out.
Jak do przodu ramię, to wydech. To do przodu, wydech.
And see if you can feel the shoulder blade. Maybe, Agnieszka, you need to detail map that's your shoulder blade so she can feel that moving across the rib cage.
Przenosić prawe bark do przodu, to poczuj, jak się przesuwa. Zobacz, jak to tu pracuje. I do tyłu.
Yeah.
No i do przodu. Mały ruch. I do tyłu.
And notice what your head does.
Zobacz, co się dzieje z głową. Znaczy obserwuj wewnętrznie, co się dzieje z głową. Musisz się patrzeć w ekran.
The head turns a little bit to the left and comes forward as well with the shoulder.
Co się dzieje z głową. Trochę do lewej strony się odkręca i idzie do przodu.
And feel the pelvis moving too on the seat.
Też poczuj, czy się przesuwa trochę.
And is it just the shoulder coming forward or is everything coming forward? The head?
Przenosić, czy całość się przenosi trochę do przodu? Nie musisz mówić.
So I don't know if I have a rest again now. And Agnieszka, you come in with your hands onto the shoulder girdle and see if you can actually differentiate the shoulder girdle from the rib cage to give her a sense of the shoulder moving separate to the rib cage.
To jest, jak się przesuwa, czujesz oddzielnie, to jest oddzielnie część ramienia, a to jest rib cage, czyli klatka piersiowa.
So perhaps now we could differentiate using the eyes and the head. So look to the right when you bring your right shoulder forward on the breath out.
Jak teraz popatrz w prawo, jak lewe bark przenosisz do przodu, w prawo i rób wydech. Ale mały ruch głowy, dobrze.
And then come back to the middle with your eyes.
Znowu. Ramię do przodu.
That's it.
I już, i rozluźniamy.
And then eyes back to the middle. Yeah, back again. As you bring the shoulder forward, you look to the right. See if you can slow down the beginning of that movement. As you begin to look to the right and as you begin to bring the shoulder forward, see if you can slow the beginning of the movement.
Zwolnij ten moment, zwolnij moment, jak zaczynasz ruch, czyli bardzo powoli, głowa i ramię w lewo, prawo, prawo, ramię do przodu, nie powoli. Staraj się zwolnić początek ruchu, tak? Wygodnie ci tak siedzieć? No. No i prosto się patrzymy, głowa wraca. Cały czas ten sam ruch, tylko bardzo powoli początek. Bardzo mały ruch.
Yeah. Good. We can make the movement even smaller if you'd like.
Jeszcze mniejsza.
Make it easier.
I wydech.
Uh-huh. So it's a bit like we're untangling patterns. Okay, have a rest again for a minute.
Odpocznij. To jest jakby odkręcanie nawykowego sposobu poruszania się. And with her hands on the table or on her
Yeah,
knees.
that's good, that's good. I can see the left hand is open more than last time. At the wrist, it's definitely open more. You know, the wrist and the first metacarpal joint. Okay, now just move your right shoulder forward. Feel if it's easier.
Right or right?
Right shoulder. It should be clearer.
Zobacz, czyli łatwiejszy ten ruch jest, bardziej jasny.
See how she uses her head and chest and all the way down to the pelvis to bring the shoulder forward?
Mhm.
Okay, next time you bring the whole shoulder, the head forward and the chest forward, leave the whole chest and head forward as the shoulder falls back. See if that's possible.
Okej. Jeszcze raz do przodu, ramię prawe i potem samo ramię wraca, a klatka piersiowa zostaje z przodu. Samo ramię spróbuję wrócić, a klatkę zostawić. Jeszcze raz, całość do przodu i teraz zostaw klatkę piersiową, a ramię tylko nie wróci.
I'd encourage you with your hands on there, Niska. It's looking at what you're doing.
Okej. Jeszcze raz lewe ramię do przodu. Samo ramię wraca. Samo ramię wraca. I prawe ramię, przepraszam, do przodu.
Okay, bring the right arm even further forward as if to reach forward with the right hand and arm.
Tak, czyli bardziej teraz prawe ramię.
You get a clear idea of the shoulder coming forward.
O.
What about using the whole arm to reach forward? The hand as well, extending the elbow. That's it. That's it. And you can slide the hand forward on the desk to reach forward with the hand. And continue with that movement if you can. Bring the hand forward. That's better. That's better. You can feel the shoulder better now. You can feel how the shoulder's actually moving separately a little bit more now. Yeah? It's clearer. Yeah?
Jak się porusza do przodu, czy nie?
Okay, leave that.
Okay.
And now do the same with the left shoulder.
Now,
Just bring the left shoulder forward and lean on the left elbow.
Teraz siedzisz wygodnie.
Don't change too much. Don't change too much. Don't.
Teraz lewe ramię. Powolutku samo ramię do przodu. Znaczy,
That's it. Beautiful. Come back again. Feel how you lean into that left elbow, into the bone of the left elbow. And here we could tap on that elbow bone with something. So you can have a little rest now for a moment and spend a moment tapping on that bone to give her more clarity of that.
On the elbow.
Yeah, you might want to go onto the other side, put your hand under the elbow, just give it a little wrap, tap, 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 wake up the bone a bit more, increase the awareness, because it's a much bigger bone and you're aiming to tap up through the long bone into the shoulder. So the line of force going up through the long bone. And then come back to do the movement again. And bringing the left shoulder forward and turning the head to the right.
Lewe ramię do przodu, delikatnie głowa w prawo.
That's it. Beautiful.
Już, wystarczy. Już, i troszeczkę, nie za dużo, lewe ramię i głowa. Lewe ramię, głowa, mały ruch, mały ruch.
Now, the next time you go forward, notice how the head turns to the right and the eyes go to the right. And this time I want you to leave the eyes to the right, looking to the right as your shoulder comes back again.
Teraz jak w prawo się odkręcasz, to obserwuj, jak głowa idzie w prawo. Jak już będziesz w prawo, to zostaw oczy, cały czas patrz na mnie, ale wróć ramieniem do tyłu. I teraz oczy zostają, a reszta wraca. Wraca ramię, wraca. Dobrze. I jeszcze raz. Do przodu. I ramię wraca. Oczy zostają. I jeszcze raz ramię. Bez wysiłku. Nie i oczy zostają. Okay.
Notice very subtly as you continue to do that movement. Continue to do the movement.
Powtarzaj ten ruch.
And what the eyes also look a little bit upward.
Nie, oczy zostają patrząc na mnie. Czy oczy trochę do góry.
Look upward even higher.
Patrz w górę. I powrót.
And then come back to the beginning, to the middle with the eyes.
I patrz.
You look up, that's it. And as you come backward, okay, have a rest again.
Pocznij.
It gets a bit confusing.
Jest. Trochę jest to mylące.
Okay, now we're going to do a different plane of action. If we put a clock on the side of your shoulder so that your left ear is looking at the clock, the middle of the clock, 12 o'clock would be upward toward the ceiling and 6 o'clock downward to the floor.
Czyli 12 godzina jest na suficie, nie musisz się patrzeć, a 6 jest w podłogę, a środa jest na wysokości ucha.
And 3 o'clock would be in front of the face and 9 o'clock behind the head.
3 jest przed twarzą, z przodu twarzy, 9 godzina jest za tobą.
Right? So go back to just moving the shoulder forward. So when you move the shoulder forward, is it all of you moving forward or just the shoulder?
Tylko ramię. I do tyłu.
the head also turns to the right when the left shoulder comes forward. What happens to the right shoulder when the left shoulder comes forward?
Co dzieje się z prawym ramieniem, jak lewe idzie do przodu?
Does the right shoulder go back as the left one comes forward?
Czy prawe ramię się cofa do tyłu, jak lewe idzie do przodu? Czy nie?
Take the right shoulder forward as the left shoulder goes backwards.
Spróbuj iść lewym do przodu, a tak, żeby prawy się cofał do tyłu. Prawy do tyłu. Dobrze. I wracamy. I wracamy do tyłu. Do pozycji wyjściowej wracamy. Usiądź mama normalnie, prosto sobie. Ale normalnie, nie musisz do przodu.
Yeah. You may feel that you're even twisting on your pelvis.
I jeszcze raz. Lewe do przodu, prawe do tyłu. Zobacz, czy twoja miednica się też skręca. I wracamy. I znowu lewe ramię do przodu.
Leave that now and rest.
Okay.
And let's move. Oh, have a rest for a moment. Just breathe.
Oddychaj sobie spokojnie. Siedź wygodnie, jeśli wygodnie ci.
Okay, now let's think of the 6 to 12 plane of your shoulder. Taking the shoulder towards 6 o'clock and 12 o'clock. So lift the shoulder upwards, the left shoulder upwards towards your left ear.
Okay, teraz lewe ramię do lewego ucha. Podnosisz trochę.
That's it. Beautiful. And then just allow it to drop down rather than try and make it come down. Allow it to drop down. Feel how you do all of that with your pelvis and your back and your ribs and your head. So the shoulder thinks it's attached to everything. It's one unit. Okay, leave that. Now do the same with your right shoulder and feel how the right shoulder does it differently. Yeah? Feel the difference? That the right shoulder knows it's separate from the rest a little bit, doesn't it? Feel how you do that with the right shoulder and the shoulder blade. And now this may be the time, Agnieszka, you could go behind Mom and palpate the left shoulder blade. Map that bone, just spend a bit of time moving around that bone, giving her a sense of the shape of that bone. And you can organize your hands to hold on to that bone and lift it up and down and side to side, and you can take it in circles. We feel, to begin with the hands on, feeling in which direction can she move easiest. And it's like finding the willingness to move, in which direction she most willing to move. Is it up or down? Is it forward or backward?
I think it's backward and down.
So take it further in the direction and bring it in the opposite direction. Now let's change the pattern of the head relative to the shoulder. And as you lift the shoulder blade upwards, get the eyes to look downwards.
Teraz będziemy podnosić lewe ramię, a oczy idą w dół przy podnoszeniu, czyli odwrotnie. Czyli podnosimy.
And then bring the eyes back to neutral, that's it. And at the moment she's doing it on the breath in. So continue to do it on the breath in. A few times and then try and do it with the breath out.
Teraz będziemy podnosić ramię przy wydechu. Czyli wydech i patrzymy w dół.
Okay.
I jeszcze raz. Oczy wracamy. Nie, poczekaj. Oczy wracają. Teraz w dół.
Leave that for a moment and just change your hands, Agnieszka, to under the armpit. So you grab hold of the arm and lift the whole arm up from the upper arm. So your hands can go under the armpit, get hold of the whole shoulder girdle, and you can lift it up off her body. Feel the whole shoulder. That's it. That's it. And then drop it down so she can feel that movement now of the shoulder girdle separate to the rib cage. Yeah? You feel that? That's really good. And what's beginning to happen at the same time now is her left arm's beginning to extend. And so is her wrist. And can you feel the bones of your fingers pressing into the table as the lift the shoulder?
Czujesz, jak palce lewej dłoni wciskają w stół, jak podnosisz ramię?
Now
Yes.
can you organize yourself, Agnieszka, still sort of staying with the same theme of lifting the shoulder, but maybe the left hand under the elbow. Yeah. And push up through the elbow to the shoulder as you lift the shoulder. That's it. Just a little bit. Still initiate from the shoulder. That's it. Do less. It's in a way, what happens is the nervous system, if you move too fast or too big, it sort of gets it's like it's really frightened. And what happened then when you first moved the arm, the wrist tightened. I don't know if you noticed that, Erg. Yeah? Okay.
Jeśli ruch jest duży, to układ nerwowy tak jakby się napinał i przestraszał, tak? Wtedy napina się bardziej lewa ręka. Jak jest mały ruch.
Okay, continue doing that with the arm and lifting, pushing up through the elbow, through the long bone, feeling the line of force going up through the elbow to the shoulder blade, the shoulder girdle and the blade sliding on the ribs. And now start to differentiate the eyeballs. Just start looking in different directions, up to the left, down to the right. Or you just maintain your rhythm, Agnieszka, of lifting and lowering on the out breath. Every time she has an out breath, lifting and then releasing on the in breath. And eyes just wander around in different directions.
Dookoła, tak? Nie w jednym miejscu, tylko wolno.
Things in a room.
Prawo, lewo. Oczy niech sobie patrzą w różne miejsca. No teraz. Bez ruszania głową, same oczy.
Okay, and leave that and have a rest again. So, how are you feeling, Mum? Okay, tell me how you feeling.
Jak się czujesz?
Proszę.
No nie, dokładniej.
Zrelaksowana.
Relaxed.
Okay. You let me know if it's too difficult.
Jak jest zbyt trudne, no to musisz powiedzieć.
It's hard to have hope, eh? Hard to have hope and to understand how we can make this work again. Very delicate.
Wszystko jest bardzo delikatne i na bardzo subtelnym
To
poziomie.
jest trudno, bo ja wszystko robiłam szybko zawsze i maksymalnym zakresem.
Yes, my mom says that the most difficult is doing very subtle movements.
Yes.
And slow, because she used to do everything fast and in the widest range. I don't know, in yeah, so.
Good point. Good point. So it's with this work, we've got to change a lot of habitual actions, how we naturally, habitually move.
Tutaj zmieniamy nawykowy sposób.
Okay, now I'm thinking just to get a little bit more active movement, if you could come onto that other side again, Agnieszka. And this time support the hand with your left hand under the wrist, I think, and then the right hand under the elbow.
Like that?
Your right hand under, oh yeah, that looks nice, that looked nice. Okay, and now imagine lifting the shoulder blade up with the whole arm. It's lifting it and dropping it. And notice now what the head does.
Zobacz, co teraz głowa robi.
And Ergo, if you could assist Agnieszka in this movement, in your imagination, if anything else, just imagine you're lifting your whole arm. Imagine your wrist is going to your mouth. And let's begin to take the mouth to the wrist as you lift the arm.
Twarz, buzię w stosunku do, zbliżasz do nadgarstka.
Głową.
Tak, no jak. Like that?
As if, yeah, exactly. As if you're going to kiss your wrist.
Muszę się pocałować w nadgarstek. No jeszcze raz.
Nice. And next time, hold it there. Hold the lips and the wrist close together.
Trzymamy tu.
Okay, as if we're kissing the wrist. Don't let the distance between the wrist and the mouth change.
Jeszcze raz. I tu przytrzymamy.
Hold it there. Now do a circle with the elbow.
Trzymamy.
Or just up and down a bit.
Trzymamy głowę.
Let the head follow the wrist.
Głowa idzie za nadgarstkiem.
So the distance between the wrist and the mouth doesn't change.
Czyli razem głowa idzie w dół i do góry.
That's it, beautiful. And start to do a circle with the wrist, with the elbow, with the shoulder blade.
Robię kółeczka.
Actually, let's stop here and wait a minute. I'm getting too far ahead of myself. Hang on a sec. We'll do a little bit more forward and backward and then come back to the circle. So that was beautiful. Hold on to the arm again. And this time, or should we go back to the shoulder? Let's try it from here to begin with. Just bring the shoulder forward and back.
But what about my hands? Should I?
Yeah, you're assisting with your hands to bring the shoulder forward.
Okay. Nie, głowa zostaje.
There you go. Just imagine bring the shoulder forward. There we go. And then back. That's it. Forward. And then think of the clock. 3 o'clock and 9 o'clock. On the left-hand side of your shoulder. Left side of your ear.
Mm-hmm.
3 to 9. Now, let's do something different with the head. The head's doing exactly what the shoulder's doing. So let's change that up by either looking to the left as the shoulder comes forward.
Patrzymy w lewo i jak w lewo głowa się przekręca.
Looking upwards, disengage the head and let the head even look, the chin move away from the chest, and the head can go backwards and forwards and to the right, to the left. Ah, beautiful. That's it. Beautiful. Okay, have a rest again. It's really nice. Okay, let's just by yourself now. Bring the shoulder back and forward.
Teraz sama. Usiądź normalnie, cofnij ramiona. Teraz lewe ramię do przodu. Nie takie duże ruchy do tyłu. Lewe ramię, lewe.
Ah, that's looking more real.
Lewe ramię do
Can you
przodu.
feel it now that you're actually learning to move the shoulder
Czy widzisz, że uczysz się
almost separately from the rest of you? There's still the rest of you's evolved, but it's beginning. You see, it can feel it. I can see it beginning.
jeszcze. Lewe
Okay, now do some up and down movements.
Teraz lewe ramię.
Think of that shoulder blade sliding on the ribs, up and down.
Shoulder blades, czyli łopatka się przesuwa. Zobacz, czy to czujesz.
It's something different with your head, so the head's not just doing everything, and the neck and the ribs. It's a shoulder that's.
Głowa nie.
That's it. That's it. That's it. Like even you're learning these little bits of gold dust in the learning how to differentiate. They're important little tools
Uczysz się rozróżniać.
that, you know, you can play using these tools yourself anytime in bed, whenever, that you can get your eyes to do something differently. So you differentiate the whole pattern. Okay, now come back again to Agnieszka, coming to the side again. Oh, what's going on here?